Hello, and welcome to the 25th Rosalynn Carter Georgia Mental Health Forum. Happy May Mental Health Month and May 20th Mental Health Day of Action. I am Eve Bird, the Director of the Mental Health Program here at the Carter Center. We are so pleased that you chose to join us today. Although the forum is totally virtual, and we hope the last totally virtual forum for many years to come, we have an engaging, information-packed, action-oriented forum planned for you. Let me provide some housekeeping so that we can be sure to have a successful virtual meeting together. Please keep your audio muted because the forum will be recorded. Closed caption will be used and will pick up any background noise or conversations. And the forum will be live streamed. So in other words, if your audio is on, your mic is hot, and we will hear what is going on where you are and calling in from. Although muted, please open your chat. You may need to take your cursor and move it to the side of your screen. This will help you remain engaged because a lot will be occurring simultaneously during our panels over the next 2 days. This is where we will post speakers' bios, supplementary information, and receive your input and questions. It is a particularly special year because we are in the midst of a year-long global celebration honoring Mrs. Carter's 50 years of advocating for mental health for all. We hope you will enjoy the quotes, photos, reflections on Mrs. Carter's dedication to the field and her bringing us all together year after year. I am sure you are like me and that you look forward to attending the forum annually. We celebrate the fact that Mrs. Carter has created this very special space in Georgia to bravely have difficult conversations, better understand each other's perspectives, and together in a unified way, and thus more effective way, improve mental health for all. We are so pleased that you have taken the action to be with us today and look forward to engaging with you to move the needle on some of Georgia's most pressing behavioral health issues. Again, welcome. And on behalf of the whole Carter Center mental health team, at this time, I want to turn it over to Jason Carter, Mrs. Rosalynn Carter's grandson and chair of the Carter Center Board of Trustees.
Good morning. On behalf of the Carter Center and on behalf of my grandparents, I'm honored to welcome all of you to the 25th Annual Rosalynn Carter Georgia Mental Health Forum. In addition to this being the 25th Annual Forum, we are so excited this year to celebrate the 50th year of my grandmother's remarkable advocacy for mental health and substance use issues. These issues are close and personal to her and my family. They have become, as you all know, a mission for her in her life. She is in Plains today, and she and my grandfather are participating virtually as observers in this event, and they send their very warmest welcome and their great thanks for all of the work and the partnership that you all have provided to the Carter Center and to my grandmother for these many years. I have a letter from my grandmother that I would like to read. Dear friends, welcome to the 25th Annual Georgia Mental Health Forum. I'm happy that we can hold this year's event virtually and pleased not only to present our fine speakers and panelists, but also with the new ways technology permits us to engage with each other. The death and deprivation caused by the pandemic have noticeably impacted public awareness of the societal factors like isolation and poverty that affect our mental and physical wellness. Public support for adequate mental health and substance use care is pronounced, and this may be the best opportunity that we have ever had to form a genuinely effective system that is equitably delivered. After 50 years of calling for change, it's thrilling to see the enthusiasm for action. In fact, I'm delighted to announce our partnership with the first ever nationwide Mental Health Action Day today, as more than 800 brands, nonprofits, government agencies, and cultural leaders, including many who work in and across Georgia, come together to empower their employees, audiences, and consumers to take action to support and maintain their mental health. It would be wonderful for this to become a movement. I'm heartened as well to know that the work of national, state, and local organizations to foster recovery for people living with mental health and substance use conditions by developing the unified vision for mental health. It would be so gratifying to see such a sweeping and holistic transformation of our systems and services. All of you here today are making these changes possible, and I applaud your good work. Despite extraordinary, difficult circumstances, you persevere to protect the mental well-being of children, the elderly, and Georgians across their lifespans. I'm proud of you. Send you my best wishes for continuing success. Thank you for attending. Sincerely, Rosalynn Carter. I can tell you that every word she speaks about mental health and about this desire for a movement is sincere and comes from her heart. So thank you to all of you who participated. And let me take a moment as the chair of the Carter Center Board to acknowledge our donors, because without them, this would not be possible. We appreciate it enormously. These are the following donors who support our Georgia activities: Casey Family Programs, the Georgia Department of Behavioral Health and Developmental Disabilities, the Georgia Department of Human Services Division of Aging Services, the Imlay Foundation, Jesse Parker Williams Foundation, John and Polly Sparks Foundation, Magellan Cares Foundation, the estate of John M. and Elizabeth D. Pope, the D&M Scheibel Family Foundation, Tull Charitable Foundation, the Wellbeing Trust, and many individual donors. Again, on behalf of the Carter Center, on behalf of my grandmother in particular, and on behalf of all of us, we welcome you to this event, and we know it's going to be a great success. So thank you very much.
Thank you, Jason, and thank you, Mrs. Carter, for your continued leadership. We look forward to the day when we are all back in the Ivan Allen Chapel at the Carter Center together for the forum. I also want to thank the mental health team program team and the team at Harkin and Brandon and his team with LPE lighting, production, and equipment who have helped us put this virtual forum together this year. I too want to thank and join Jason in thanking our donors who without their support, we could not hold the forum or carry out our work. Again, we remind you to remain muted so that the background noise does not come a part of the closed caption or recording. However, remain engaged by opening your chat. If you need anything as you navigate the program over the next 2 days, you can reach out to Anna Cunningham in the chat via private message. You also can share comments for everyone to see. Please share your thoughts and reactions to speakers. And with that, I'm thrilled to welcome Diane Waugh, Respect Speaker, to formally kick off the work of the Georgia Mental Health Forum. Diane, thank you for joining us today and sharing your story.
Thank you, and good afternoon, everyone. Hi, my name is Diane Waugh, and the title of my story is The How and Why of It. There's nothing unusual about growing up in the early 1960s in Harlem. However, doing so in a single-parent household with my dad was totally unique. My mother gave me to my father when I was about 6 months old. We were very poor, and I experienced many nights of hunger and no electricity. Yet I was rich with attention from my dad. He created a fantasy world to help ease the pains of our situation. Poverty, stress, and embarrassment ruled while the seeds of depression, self-esteem, and addiction were planted. When I was about 5, I pondered on questions like, who am I? Whose am I? How did I get here? Why am I here? And if there is a God, why doesn't he come visit me? On the flip side of the poverty, however, we traveled a lot, and I was exposed to other parts of the country and the Caribbean during my youth. I was extremely smart, and for this, I got a lot of praise from my family and their friends. Memories of torment, teasing, bullying from my schoolmates describe my teen years. I was fat. I was forced to wear an afro when everyone else had ponytails. And most of the time, my wardrobe consisted of dirty clothes, and good hygiene just wasn't existent. When I was about 15, I met my mother. I was so excited, but once again, she rejected me. And this caused me to feel terrible about myself. To counter this, I got busy and I joined a drum and bugle corps. I learned to play baritone and traveled all over the country in the summertime and then practiced 3 times a week in the winter. This served as an avenue to escape my reality. Then I began to experiment with marijuana, alcohol, and sex. I got into an abusive relationship at 16. Now, looking back, I hated the abuse, but in order to feel a part of something, I stayed. I dropped out of high school, but was able to get my GED. For some reason, I stopped drinking and I stopped smoking weed, but I still couldn't leave him. He beat me for 10 years. I remember hating it, yet feeling this was the best I could ever get. Depression became a frequent visitor in my life, but I didn't know it was depression because it always disguised itself. I didn't understand why the sun never shined or why it only shined when I was traveling or fantasizing. In my early 20s, I was introduced to cocaine. I didn't understand the high, so I stopped using it. I was a dancer, performed up and down the East Coast, and I never got caught up in the casting couch, its drugs, nor its sex. I made my money and I came home. While the abuse worsened, I was introduced to crack cocaine. Oh my God, what a rush into fantasy. I was in love. It became my master, the rapacious creditor that demanded payment by any means necessary. For some of my peers, this was the end of their story, but not for me. I had a purpose, albeit unknown. Now, during my crackscapade, I sold my body, I stole, I begged and borrowed to get the next fixed. When it called my name, I stood at attention. Then one day, after carrying my baby for 9 months, I took a stroll on the streets of Harlem. I picked up a man who took me to his home where he had 8 of his comrades waiting. They raped me. And the next day, I gave birth to my daughter. She was born with no drugs in her system, no deformities or disabilities. This was my first introduction to God. 3 months later, I went into long-term treatment where I learned how to live, how to be a mom, how to work, how to succeed. My dad died shortly thereafter, and I moved to Atlanta to be with my mother and sisters. The mommy and me relationship, however, it still eluded me. So I was determined to give my daughter all that I never had. I worked my butt off. I started at $10 per hour, and I worked my way up to 6 figures. I went from a GED to a master's degree. I got married. I had the big house, the luxury car, the fine clothes, and most of all, a beautiful daughter who excelled in sports. She went to Hampton University on an athletic scholarship. Yes, I had it all. Then my body began to betray me. I had 2 back surgeries and both of my hips were replaced. At this point, I had been clean for about 25 years. Then that old master called, and when he called, I had no defense. I got hooked on pain pills. Yes, this 6-figure professional, caught up in the opioid epidemic, I was still experiencing abandonment and low self-esteem. Fantasy, it was still more palatable than life. I went to 3 mental health treatment facilities. I was evaluated and diagnosed. Major depressive disorder and post-traumatic stress disorder. Finally, the why. I got into therapy. I poured my heart out. I stayed clean in intervals, yet peace and serenity, they still eluded me. I was back on crack. Darn. I believe in every man, woman, boy, and girl, there's a fundamental idea of God. The God within me never gave up on me. He filled the void in my soul, and my spirit was awakened. I finally had the strength to get therapy, plus medication, and attend 12-step programs. Voila, I could have had a V8. I am now well on my way to a life of freedom, peace, serenity, and self-love. I have a God of my understanding who loves me, forgives me, guides me, and treasures me. Life on its own terms. No longer do I rely on fantasy to get through my days. I'm empowered because I know the why of it. Today, I just don't exist. I live my life out loud. I now have attainable life goals, which include maintaining a healthy mental state of being and remaining clean and sober. Oh, did I mention that I'm an actress, but I just haven't been discovered yet? My dream is to be Denzel Washington's leading lady. To my peers, I have two suggestions. One, I suggest you develop and maintain a conscious relationship with a higher power of your understanding. And two, find the recovery path that works for you and stay on it. To the leaders of the behavioral health systems, please remember that substance abuse seldom exists without some form of mental illness. Both need to be acknowledged, diagnosed, and treated with dignity, respect, and compassion. Finally, please continue doing exactly what we are doing right now. Giving peers the opportunity to share their stories allows us to have a platform where you're not limited to evaluating us, treating us, or judging our behavior. By sharing my story with you today, you are able to see my resilience, my endurance, my sense of humor, and my passion to advocate. Together, we can change generations one person at a time by getting to know the how of it and discovering the why of it. Thank you for listening to my story.
Wow. Diane, thank you for sharing your story and grounding our work today in the Mental Health Forum in the reality of your story and the story of so many others. Thank you all, the participants, for your comments, affirmations, and reflections on Diane's stories.
Thank you.
Please continue to engage in the chat. Again, Diane, thank you so much.
And thank you.
I'll put out a call to Denzel Washington for you, okay?
Thank you.
As you all know, we're in the midst of the mental health crisis that is taking massive social, economic toll on our state and the nation. During 2020, a year of unprecedented isolation and uncertainties, which caused the population as a whole to realize the importance of our own personal mental health, the mental health of organizations we work for, and our governing bodies to invest in mental health. 14 of the nation's leading mental health advocacy organizations and professional associations came together to create a united vision for transforming mental health and substance use care. A consensus strategy which includes 7 elements, equally important, and that must be integrated for us to be successful in addressing the nation's mental health and well-being. Let's now hear from 2 of the CEOs on the unified vision and their message to us here in Georgia.
Thank you for inviting me and for our deep partnership over the years. My first involvement with the Carter Center began over 30 years ago in conversations around faith and health. And I want to join the nation in congratulating Mrs. Carter for her extraordinary leadership over a half a century in helping reduce mental health stigma and ensure that mental health access and care is there for all in this country. With COVID, the numbers like only 1 in 5 of us are experiencing mental health became 1 in 1. And one of the shadow gifts of this time is recognizing that mental health and addiction challenges, thoughts of suicide, and people struggling with loneliness and isolation is all of us, not just some of us. And that sets an extraordinary stage for what we want to be able to talk about today. While Wellbeing Trust is working with the Carter Center to help advance mental health parity in Georgia and in other states across the country, today we're here to talk about the Unified Vision, which is an historic alignment of over 50 national organizations who often have similar values, but have never really aligned on a common agenda for what our nation must do to be able to save lives from deaths by alcohol, opioids, and suicide, and help increase equitable well-being for all in the country. Dan Gillison, the CEO of NAMI, and I started convening over a year ago a dialogue between these organizations that by Thanksgiving became a unified vision rooted in 7 pillars that not only start with early identification and prevention and ensure equity, but all the way to make sure that every person in this country can get affordable access to mental health care, as well as those conditions in communities that give rise to mental health and well-being in the first place. We encourage you to join us in this and thank the Carter Center for its leadership in our nation.
Hi, I'm Arthur Evans, Chief Executive Officer of the American Psychological Association. Thank you for inviting me today. I'm so honored to have this opportunity to say a few words as we begin the 25th Annual Rosalynn Carter Georgia Mental Health Forum. Mrs. Carter's leadership over the last 50 years and all the work that the Carter Center has done in making a real difference in how people view and experience mental health and health care. I'm sure I don't need to tell you all how critical and timely these conversations about mental health issues are for Georgia and for the rest of the nation. The challenges we have experienced over the last year have only complicated the issues we were already facing around building an integrated, accessible, and equitable mental health care system. It has become painstakingly clear that for the sake of the nation's mental health and well-being, that we cannot afford to continue to do what we've always done and expect to get better outcomes for people. We must do things differently. This need is what has brought together the unified vision into existence. It's an unprecedented step of some of the nation's leading organizations with many similar ideas to look at how we can develop a common agenda that addresses the current mental health and substance use needs and ensure that we have an equitable system that elevates the well-being of all people. The recommendations in this unified vision encourage us to transform systems for the better and chart a fresh new course for mental health care. They stress the need for a population health approach, where the goal is to improve the health status of all people, not only those who have a diagnosis. And they reflect the critical importance of fostering diversity and promoting inclusivity to ensure the best health outcomes. And they make abundantly clear the need for an integrated and interconnected approach among systems and communities in order for us to be successful. So, as you listen to today's speakers and have conversations with other attendees, I hope the unified vision inspires you to think creatively and boldly about how we can come together to address stigma, improve policy, and work toward a better mental health for all.
Thank you, Tyler and Arthur, for your inspiring comments. Greatly appreciated. The unified vision focuses on 7 critical pillars or elements: early identification and prevention, emergency and crisis response, equity, integration, parity, standards, and workforce. All of these elements are equally important, with each receiving equal attention. The sum of all the parts will make behavioral health services and supports more accessible, equitable, and are needed to support recovery. We must advance these critical elements through an equity lens to eliminate barriers to mental health care and prioritize the needs of disproportionately impacted persons. Now we want to hear from you. Where do you think Georgia is in its work towards realizing the unified vision? We've placed a screen here for you to see the elements. We would like you to answer the following 2 poll questions. Then we will ask 2 Georgians to reflect on Georgia's work and your answers. At this time, you may need to take your cursor and move your chat bar to the side of your screen so that you can see the questions. and then the reference slide. So the two questions are, recognizing that all elements work together and cannot stand alone. In Georgia, under which of the Unified Vision's 7 critical elements have we made the most progress on over the past 25 years? You can select more than one. Please go ahead and participate in the poll. Okay. Finishing up your response, we'll move to the second poll question. In Georgia, under which of the 7 critical elements do we have the greatest opportunity to improve? Again, you may select more than one. Please complete the poll. Anna, I think some people are having difficulty. There we go. All right. I apologize for those that you weren't able to see. All right. So here are our results. Our Georgia participants believe that Georgia has made the greatest progress in the area of emergency crisis response, second in early identification and prevention, and third in our standards. We'll wait a minute while Anna shares the results of our second poll. There we go. All right. This is the one that we just saw, I believe, Anna.
I'm going to read the results.
Okay.
If everyone
Wonderful.
scrolls down, in Georgia, where we have the greatest opportunity for improvement is equity, followed by early identification and prevention, and parity. Whoops, I'm sorry, workforce. Workforce, thank you.
Great. Thank you all for participating. Okay, at this time, I have the pleasure of introducing Abdul Henderson, Executive Director of Mental Health America of Georgia, and Kim Jones, Executive Director of National Alliance on Mental Illness in Georgia. Please see the chat for both Kim and Abdul's bios. Welcome, Kim and Abdul. And Abdul, a special welcome because I think this is your first Georgia Mental Health Forum. We're so glad that you and Kim could join us. I know your organizations have been working together to develop a unified strategy. I'd like to turn it over to the two of you to share what it is that you've been working on.
Absolutely. Thank you so much, Eve. I'm I don't see Abdul on my screen, so I wanted to see. There he is.
The host controls my video, so they have to unlock it.
Well, while we're waiting for that, I would just like to say thank you to Ms. Carter for her lifetime work on mental health. We are so lucky to have her here in Georgia, and so lucky that she started this event and that we have it annually. So on behalf of NAMI Georgia, I just want to say thank you to her and her lifetime achievement in mental health. And thank you to the Carter Center for having us today.
You have to re-enable your video, sir. I can only turn it off at my side.
Yeah, I'm clicking on it. It says you cannot start your video because the host has stopped it. Okay, there we go.
We see you now, Abdul.
Okay, great. So I just want to echo Kim's words. I just want to thank Mrs. Carter for her extraordinary leadership in mental health, the Carter family for their dedication to our country and to serving us. And thank you to the Carter Center for allowing me to participate in this forum. Kim and I are going to walk everyone through a brief presentation on where we are in Georgia with respect to the 7 pillars under the unified vision. I will briefly talk about the each pillar, and then Kim will update everyone on where we are legislatively with some of these and where we can go. So if we can go to the next slide, please. Okay, what's at stake? There is a lot at stake. People's lives are at stake. There must be more that is done in terms to provide access to mental health care in the state of Georgia. Now, here are some numbers of where we are. Georgia places 51st when it comes to access to mental health care. We're beyond dead last. That should change. It needs to change. And so legislatively, how are we working to solve these problems? And so with the work of NAMI and our other partners in the advocacy space, we've tracked over 90 bills during this 2021 legislative session. Out of those 90 bills, 22 crossed over. Of those, 14 have been passed and sent to the governor. Another thing that is at stake that I didn't mention in the beginning is that later on this month, MHA National is going to release a report towards the end of this month on suicide. And it's going to show that there are 2 counties in Georgia, Lee County and Haralson, that are going to rank in the top 20 for suicide ideation. And so there is a lot of work to be done here in this state. Kim?
Yeah, I cannot agree with Abdul more. What is so exciting about the unified vision is this is something that NAMI and Mental Health America started working on in conjunction with the American Foundation of Suicide Prevention probably about 5 years ago, and realizing that coming together and working with one voice is more powerful with our legislators. And it is so exciting to see us have this come from our national level down to our state level. And I agree with Abdul. Our experience within the legislative session last year, we had many legislators who are very interested in making a change in mental health. They understand that now is the time. They understand that the second pandemic will be mental health, and we have the opportunity now to make a change and to be prepared for that, unlike we were for the COVID pandemic. So we are seeing an incredible interest from our legislators to make something happen. We also know that our governor supported the Behavioral Health Innovation and Reform Commission, that although had its first or second meeting right when COVID hit, continued to meet and put out a report. And many of the things that came out of that report are listed in what we're about to go over here. And if you recall, last year, our Speaker of the House, Speaker Ralston, quoted two priorities for this legislative two-year session. One was election reform, and the second one was mental health. So now more than ever, I think this is perfect timing for us to talk about a unified vision, and for us as the advocacy group in Georgia to really get focused and clear on what it is we want to do in Georgia to make us better for the people we serve.
Okay, next slide, please. So early identification and prevention. It is critical that Georgia places an emphasis on increasing efforts on early identification and prevention. This is very key to what we're in the business of, which is saving lives. Here are a few, I'm not gonna go bullet by bullet, but here are a few of the efforts that we are working on in relation to this. Expanding school-based mental health services, continuing the expansion of mental health awareness training and suicide prevention activities. And so these are some of the things that we are strongly pushing to have the state invest more and do more so we can help people. And Kim, update folks on any related legislation.
Sure. So what we are doing, Mental Health America, myself, and the AFSP, American Foundation for Suicide Prevention, started a similar unified group called the Georgia Mental Health Public Policy Partnership. And what we have done is we have, as Abdul said earlier, we're reviewing those 90 bills that are currently already dropped and in action on our state legislation in our General Assembly. On early intervention, we already have 40 bills that address early intervention and prevention for mental health. We've listed here one of them, House Bill 272, that many of us, I believe everybody in the room has supported, and that is lifting the age to 17-year-olds as it comes to the juvenile justice system. So that is just a really good example of one of the bills that we already have out there that is in session, has support, has been dropped, and has already passed the House and is going to be looked at in the Senate next year, and something that we are hoping that as an advocacy group that we can all get behind and help our legislators know that this is an important bill, and this is something that would help in one of these pillars, early identification and prevention. One other thing that I just want to say before we leave this slide, one of my soapboxes that I can't leave this slide without saying is when we talk about children, we have to remember, I work with a lot of funders and everybody wants to fund children, but children go home to families. They go home to adults who care for them the best they know how. So as we look at early intervention and prevention, or early identification and prevention, it's important to remember that identifying for adults who are with mental health illnesses and preventing that is just as important as funding programs that are for children. If we fund programs that for children and then send them home to adults and family lives that are unstable, it's just almost working backwards. So that would be my comment on that. Next slide.
Okay, so integration. I'm sure many of you have heard the statement, your physical health is just as important as your mental health. This is so very true. So in the state of Georgia, we need to create integrated systems of care where we need to work towards co-locating mental health clinicians and primary care and vice versa, where we have escaping me right now, where we have primary care physician and mental health care centers. Also, we need to also have the use of screening tools in primary care centers. And this is very key, especially when it comes to in my opinion, to substance abuse issues. Because if someone is coming into a primary care facility that may be suffering from a liver issue, they're going to treat the liver issue without ever asking the person, are they suffering from depression? Are they experience a traumatic event that may be causing them to use a particular substance? And I say that because this has actually happened to a family member of mine that is actually going through this process as we speak. Kim?
Yes, in this integration, we have 5 bills that are active right now, and you'll see the one that we highlighted here. And this was just a really good example of a bill that was improving upon a system that we already have. And that was enabling Georgians to use the SNAP program to identify and automatically enroll children into Medicaid. Such an important part of how we can do simple things that are already in process to improve what we do for mental health. So just another great example, this legislation already passed and was signed by the governor. Next slide.
Okay, workforce. So there are many workforce issues that are critical to Georgia, especially in low income and rural areas. There are several things that we feel that should be done. One, building out tele-behavioral health expansion, modernizing scope of practice regulations, and training in substance abuse amongst all clinical professions. And so we feel that these are ways, in addition to the other bullet points, that we could improve and expand access to all Georgians. Kim?
Yes, on workforce, we all know if you have tried to get help for substance abuse or your mental health condition, I think anybody who's ever been down that path, and we at NAMI hear from parents and from peers every day who struggle to find help. Telehealth, we feel like, is one of the most important ways that we can expand access to our workforce here in Georgia. And we do or have heard that that might be one of the areas that they use the American Rescue Funds for. But there are currently 15 bills that relate to workforce development as it relates to mental health. Again, we've given you one here, House Bill 307, and this ensures insurance coverage for telemedicine. So critically important for what we found out during COVID, how much work we can do with telemedicine versus going in person. Again, expanding telehealth to our rural Georgia areas and making sure that that access is available to people in areas outside of Atlanta really helps us with equity as well. So making sure that we are looking at the bills that are already listed and getting them passed. And in this situation for House Bill 307, it was passed by the legislature and already signed by the governor. Next.
All right, emergency and crisis response. So now this was number 1 in the poll with regards to has anything improved over the last 25 years? That is great news. However, there is more that can be done. I feel that we must be better prepared to deal with crisis in real time. Being able to respond almost instantaneously to a traumatic event is key to diminishing life-threatening events. Therefore, the rapid deployment of intervention and prevention services are a critical element of any community-based system of care. And here are a few things that we feel that are key to that. Co-responder model of law enforcement and mental health clinicians. That is a critical aspect. Let's take law enforcement out of a lot of mental health issues and put in a trained clinician to be able to assist that person so law enforcement don't respond in potentially a negative way. Utilizing mobile assessment team services, putting people on the ground that are able to move and respond quickly, and the utilization of 988 suicide prevention hotline. We feel that in addition to others, that these are three critical elements in terms of expanding in the state of Georgia. Kim?
For emergency and crisis response, we have currently 8 bills that are being looked at in our legislation body right now. House Bill 752 is just an example of one that has been introduced and that we most certainly will hope will get passed next year. But I think another really important area to talk about when we talk about emergency and crisis response are our peer-led programs. We know that our certified peer specialists are critical not only to our workforce, but especially our emergency and crisis response situations. Our CARES team, our CPSs, our forensic peers, all of those are critical to making sure that what we do here in Georgia, we move the needle. Our workforce shortage is so critical, and that ends up putting people into an emergency and crisis response. So we're very hopeful that we will see movement in our peer programs and peer support from our legislators to ensure and to help make sure that our workforce and emergency crisis response is built out to hopefully avoid crisis and get people back into the care that they need. Next slide.
Okay, parity. Parity is extremely important because we must know where the state of Georgia stands in regards to compliance with federal law. We need to know our insurance providers upholding their end of the bargain when it comes to access to mental health services. And so there are several things that we are pushing. Funding a staff person at Department of Insurance to oversee compliance. I know that over the last couple of years, due to austerity, they had to let go a lot of people or reassign people to different work. And so right now, no one is working on parity compliance. Contract language that is inclusive of parity provision, and then letting insured persons know that they can complain about not receiving services. That one's not listed on here, but a lot of times, and folks that I have talked to, that they don't know that they can complain about their insurance company, and they don't know where to go. And so I think that is a critical element to actually start to receive reporting data to where it's more accurate, because right now, DOI does not have enough data, in my opinion, to support that people aren't complaining about access. So Kim?
As everybody knows, parity has been a federal law for over 10 years now. The Carter Center has been instrumental in making sure and working with the Kennedy Forum to get that law passed. I explain this parity issue to many as explaining it as having a speed limit without any police officers to enforce it. So it's imperative that we have legislation and monitoring systems in place that allow our legislators and our government to monitor whether parity is actually being followed. One piece of legislation that passed last year was SB 80. Unfortunately, we had some key components taken out of that bill, but that legislator has met with us again, and we are hopeful to have another form of that bill go in at this session. But we definitely would love to see some parity addressed. We feel like that would help with the workforce portion of what we need to accomplish here in Georgia as well, by getting workforce and getting people paid. There is no health without mental health, as we all know here in this room, but making sure our legislators understand that we need to have parity at all levels to ensure that everybody is covered at the same rate. Next slide.
All right, equity. So equity is, I believe, on the second poll question. I think it was one of the lowest in terms of it may have been the first poll question, but it was in terms of improvement. This is where we need to do a great deal of improvement, is in equity. So we must work to ensure that everyone has access to care and that no one is left behind based on race, ethnicity, sexuality, etc. We should also expand cultural awareness and diversity training. And then another very important thing that is associated with mental health is everything. Everything that impacts a person impacts mental health, whether it's the water you drink, the air you breathe, do you have housing, do you have transportation and employment? All of these things can impact mental health and or prevent you from accessing mental health. So equity is an extremely important aspect, and especially when it comes to the educational piece. Now, work definitely has to be done within building school to university pipelines and university and to workforce pipelines, and in my opinion, in at-risk communities. Having grown up, I'm originally from Los Angeles, from South Central Los Angeles. For people who know that term, they call it South LA now. But I grew up in a community that was under siege during the crack epidemic. And when you're in school, I went to Crenshaw High School, and when you're in school, you do not know your path forward to a lot of career opportunities. So when I'd say school to university pipelines, going into these communities that are impacted by trauma and letting them know that working in the mental health field is an option for you. So I believe equity is extremely important. Kim?
Yeah, equity, I agree with you, Abdul. And one of the things that is so interesting is when we look at COVID, it really hit all of the social determinants, employment, housing, transportation, food shortages, all those things. COVID pandemic really made an impact there. So it's really important that we take a hard look at equity. I'm proud to say that we had 31 bills this legislative session that have already been dropped and address equity. And we've put one of them here again, and that was House Bill 146, looking at parental leaves. This one passed in the legislation and was signed by the governor. So we still have a ways to go, but we have 31 bills to look at for next session. As a reminder for many of you, this is a 2-year session, so there are more bills that can be dropped. So the 90 bills that we are talking about right now are just the ones that were dropped the first year. We know there are more coming. So very exciting to see the opportunities that we have going forward. Next slide.
Okay, standards. So with standards, we're talking about ensuring there are evidence-based standards of treatment and care available for people in need, establishing a best practice, or as I was told the other day, the best effective way for access to care. And so 2 of those things I'm only going to highlight, which is identify access to care, best practice or effectiveness, and build statewide trauma-informed knowledge base. So we feel that those are just a couple ways of how we can improve standards in the state of Georgia. Kim?
Yeah, thank you, Abdul. When I think of standards, I think of data. When we're going to measure, what gets measured, what gets done. So really important part of what we're trying to accomplish. We have 13 bills that address standards in relation to mental health. Again, there's one listed here, SB 82, which protects patients who visit the emergency room due to symptoms under the prudent layperson standard. This one has passed the Senate, but remains in the House. So again, 13 bills are a lot of movement, and I hope that everybody will take time to really look into those and see what we need to do to help improve the standards in measuring what gets done in mental health. Next slide.
So that's it. Thank you for listening to us.
Thank you, Abdul and Kim. And if you just stay on camera, I would like to ask you and our participants a couple of questions here. Yes, the two that equity and prevention and early intervention, I think were two of the three that came up as where we can continue to do work. We've made great strides in prevention and early intervention, but could do greater work. Can you both give us some examples of how persons who have been traditionally excluded in system design and mental health system design, substance use care and system design are now or should be included in that? I ask this question because for so long, persons with mental illness and substance use disorders themselves have been excluded. We can't continue to make this mistake. And I also welcome participants to put in the chat examples that they've seen in their organizations, communities, networks of how persons who have been excluded traditionally are now being included or should be included.
Eve, I agree with you wholeheartedly. You know, we are known in the state of Georgia for our CPS, and there's nothing about us without us. And what I would speak to and say to our peers and the people is, don't be excluded. Many of the meetings are open. Make sure you go and attend, pay attention to when these meetings are, and get there. Get there and speak up. I want to make sure, you know, that's one thing in being on the Behavioral Health Innovation and Reform Commission that I have brought to them is, you know, talking about substance abuse being at the table and having peers at the table. They are open to that. And I have found that in a lot of these meetings, they're open to suggestions for the agenda as well. So my recommendation would be to let's be heard. It's time for us to be loud and proud. And I at least the people I'm talking to are willing and saying they are willing to let us participate.
Yeah, the only thing I will add is just when it comes to system design or redesign, it all depends. You know, it's important to know who's at the table. When you have an inclusive body of people who are at the table with different lived experience or shared experience, then you have a better diversity of thought in terms of process. So just being open and inclusive to who is at these tables is extremely important.
We've had a great, and I appreciate the comments that are being put in the chat as well, and want to share with you all that at the conclusion of this event, we'll be pulling together a report and document, and your input will be most definitely included there as well. Along the lines of prevention and early intervention, we've talked, and also in parity, we've talked a lot about including stakeholders outside of the health, mental health, disabilities community as needing to be a part of the solution. We've been a somewhat narrow, kind of always, in some ways, perhaps speaking to the choir, if you will. What are some key stakeholders, populations, organizations, sectors that we need to bring to the table to advance prevention and early intervention in mental health and substance use?
Eve, at NAMI, Georgia, our strategic plan, our vision for our strategic plan was to revolutionize the way Georgia thinks and does mental health. We're 51st. You can't get any worse than that. I didn't even know you could become 51st really in that poll. But so what I say to all of us here in Georgia, it is going to take every single one of us. We have one of the lowest tax bases in the nation, and that is how many of these states pay for mental health. I don't see that changing, although I think it should change. I just can't imagine that would happen anytime soon. I would love to see a leader take charge and ask everyone to step in when it comes to mental health. Become educated, become aware. If you're a leader of an organization, if you're a leader of a company, put that into your company culture. If you, just another way to think about that, when we think about first aid, CPR, that is done at every single company. Oftentimes, multiple times. I can't tell you the number of times I took that class. What if we did mental health first aid that way? What a difference that we would have if we had companies that really embraced it in the same way that we embrace physical health. So I don't think there should be any limit. It should just be everybody in Georgia coming to the table and making it a priority for us here.
Great.
Yeah, I would like to add that, we're in a crisis situation. The state of Georgia is in a crisis situation with mental health. And as kids return to school and the fear of returning to in-person learning and the stresses that have come up from the virtual environment, we're looking at a potential second wave of mental health crises, right? And we're talking this in a few months. Come August. So I think it's extremely important to start to engage our non-traditional stakeholders, which are our constituencies, the people who suffer through this. We need them out there with us as well. Any movement has to be organized, and it starts with the people on the ground. And most importantly, a lot of these people are voters, and elected officials listen to voters. I strongly feel that with this governor's race coming up, I'm nonpartisan. Like, I don't care. Well, I do care who wins, but I will say that the mental health should be the word out of any candidate's mouth. Like, they need to be talking about mental health publicly. Mental health should be a part of any platform committee from any partisan party, right? And so I think it's prudent for us to combine our constituencies and organize our folks to start calling and showing up, because people will respond to that.
And I'd like to piggyback on what Abdul was just saying as well. When we look at the pandemic, look at how much we all came together and worked together in different ways through the school systems and through the hospital systems to address the pandemic of COVID. We're about to have a pandemic of mental health, and that's what I hope we will do as a state as well. And again, echoing what Abdul said about there are several legislative races that are going to be held. And I hope that we as advocates are all asking every person who's running, what about mental health? This year, and I don't know why I didn't think of it next year, when my phone rings and I get that candidate call, which we all got over and over again, this time I want to hang on the line and say, yeah, I want to talk to you. I want to talk to you about mental health. What is your candidate going to do about mental health here in Georgia?
I so much agree. And I think that there is so much opportunity with, unfortunately, as a result of the pandemic, so many individuals, it has touched their lives so much more than ever before. I think of women's clubs and Boy Scouts and just all of our community service groups, and could play such a valuable role in advancing this and educating the greater public. In closing, before we go on, I would like for you all to share some of these opportunities that are underway to collaborate across stakeholder organizations and sectors that are taking place right now. And I hope that participants will put these in the chat, because most, if not all, of these coalitions, collaboratives are open to individuals and other organizations. Just because someone maybe doesn't participate in a healthcare organization or a mental health services organization or a policy organization, others are very much welcome to those to that table. An example I'd like to give is the Georgia Older Adult and Behavioral Health Coalition, where we speak every other month about the gaps and needs and services for older adults with severe mental illness and dementia. There's a inner directors team that meets. Abdul and Kim, can you share some more of these? I think you mentioned earlier the Georgia Mental Health Public Policy Collaborative. So these are all ways that we can educate ourselves and become more action oriented.
Absolutely. I can speak about the Georgia Mental Health Policy Partnership probably the best. It was, as I said, something that we created, and we created it to focus on what could be done in Georgia, what could be done for behavioral health, mental health, and substance abuse, instead of focusing on the things we disagreed on. I think in mental health, we're great advocates. We're great sometimes at being what I call the angry advocate, but what we're not so great on all the time is coming together on where we agree and getting focused on that. And I think when we can do that and we can speak to legislators and get clear on, okay, we agree on these, there's 90 bills. Let's say we agree on 20 of them. This is important to us, and we can stand and put those bills in front of legislators with all of our logos on there. That becomes powerful. Then they know what direction to take. We can still disagree on other things, but I think it's so critically important to make sure that legislators know what we do agree on so that that can be done. Being 51st, we can only, moving the needle at any point at this point would be great. So that's my thought. And I love joining other coalitions and hearing the different things and just where we can agree, let's be clear.
I concur with Kim wholeheartedly. I will, in addition, add to that from a policy perspective. I think it's critical for us to create, and I think this is what I feel what the unified vision is about, is for the state of Georgia specifically, is that we need to create an omnibus piece of legislation under the 7 pillars. Each pillar its own section, and obviously any piece of policy could have additional sections, but things that, like Kim said, that we all agree on across the advocacy community that we can then present as a unified front to the state. That way, it's the interesting thing about Georgia is that it's only a 40-day legislative session. That is really, really, really fast. And so, in my opinion, a great deal of legislating gets done over the summer and the fall. And so, therefore, if we wait till January, we're already too late. We're behind the 8 ball on that one. And so, therefore, we need to have a more unified front with a larger package that benefits everybody. And granted, the one thing about policy, especially with omnibus legislation, is that even though certain sections, the whole thing won't get passed, but if we can just carve out pieces of legislation or pieces of it, that get attached to another driving vehicle that passes, we can take that as a win. And like Kim said, like moving the needle to 50th is better than being 51st. I come from a philosophy, don't let perfection be the enemy of the good. And so therefore we all have to get on the same page in order to move in a positive direction, because it's needed here. Like, people are suffering in the end. Like, people, what breaks my heart when I think about it, especially when it comes to data, when you look at the data pertaining that the second leading cause of death from people ages 10 to 34 is death by suicide. That tells me that people are opting out of life. They are making a decision that they don't want to live anymore. And that is, I can't fathom having to go through the painstaking process of having to make that decision. And so we have to do better to prevent people from going through that process. And the only way I feel that we get better is unity. And I believe the unified vision is the vehicle that can help us get there.
And Eve, I can't leave this conversation without reminding everybody that we have a wonderful coalition, the Behavioral Health Service Coalition, that puts together Mental Health Day at the Capitol every year. And that has grown the last several years. We've gotten very clear on a unified voice. That will be happening this year. I wish I would have gotten a date, late January, early February. So paying attention and participating in that and helping us go to the legislators with that unified vision as a constituent would make a big difference this year.
Great point, Kim, and thank you, Abdul. And equally as important as us inviting various stakeholders, individuals to the table, I think it's really important and being intentional in our diversity and inclusion to make invitations and make sure that we have wide representation. So I really charge those of us that are in positions where we convene or lead coalitions, collaboratives, partnerships to make sure that we're casting a wide net and including all Georgians, regardless of race, color, sex, creed. So thank you all so very much for your time. Great session. Kim and Abdul, thank you for leading in this unified vision. Many of us are on board and look to continue to work with you. I think we're off to a good start for the forum today. We want to invite you to take a brief break from the screen, but don't go too far or for too long. We hope that you will use some of the 15 minutes to enjoy the music and join us in celebrating Mrs. Carter with some photographs that we've compiled. We will start back promptly at 2:30, and we'll have a conversation with sectors of our community who have been hit hard by the pandemic and have begun to engage with us in creating this unified vision. So enjoy your break, enjoy the pictures, and we'll see you promptly at 2:30. Thank you all. afternoon and welcome back. Now more than ever, access to behavioral health and well-being care is a top priority for all of us. As we collectively recognize that there is no health without mental health, and there is a greater awareness by multiple sectors, the importance of mental health for those they represent. And it is now time that the mental health community broaden our allies in the fight for mental health for all. In this session, we will hear directly from Georgians about their experiences and how we can engage them in our advocacy work. I'd now like to turn it over to Carrie Cobham, award-winning journalist, and someone who has most recently published in the New York Times articles on the impact of COVID on journalists and on the impact of COVID on herself as a parent. The Senior Associate Director for the Rosalynn Carter Mental Health Journalism Program, to lead the next conversation. Turning it over to you, Carrie.
Thank you, Eve. It's really good to be here, and it is good to see all of you and be with all of you to talk about what I think is such an incredibly important topic that has touched all of our lives in the past year, whether we are in the mental health community or not. Today, we're going to talk about mental health for all, and we have a great group of folks from various communities that will be joining us today. So I would like to welcome Christine Werner. Christine is the Secretary of the Board of Trustees for the National Multiple Sclerosis Society, Georgia chapter. So thank you for joining us today, Christine. We also have Miriam Persal and Charlie Wood. Both of them were former interns with the mental health program at the Carter Center, and they have just been wonderful. And we're really lucky to have them and hear their perspective on mental health as young adults and as college and graduate students. And then we also have with us today Jen Hittinger Kendrick. She is co-founder and Marketing and Communications Director of the Giving Kitchen. And Jen will be speaking to us about what the experience has been like for food service workers and as an industry that's been really strongly impacted by behavioral healthcare access issues. So welcome everyone. We're so excited to have you today. We're hoping you're not going to see any slides from us. So we're hoping that we'll be able to have just a robust discussion, sharing our experiences, adding some perspective to the Mental Health Forum today. So before we get into hearing from the good folks with us here today, let me tell you a little bit about me and what my story is, because we're going to hear everyone's stories that have joined us. So I've been a journalist for about 16 years, and over that time, I have done some amazing stories and met some great people. But I've also interviewed people during, the most traumatic periods of their lives and right after a loss when it is fresh. And in that way, I have carried with me vicarious trauma for a prolonged period of time. I've also been in a position where I had to support staff who are on the front lines, journalists who are on the front lines covering racial violence, journalists who are facing issues with online harassment, violence in person, particularly if as a journalist of color and as a woman, and journalists who are, even pre-pandemic, we're just covering mass shooting after mass shooting, and that takes its toll, and that stays with you. So part of the reason that I came to the Carter Center is to better support the mental health reporting. And I think over the last year, we really refocused on journalists' mental health as well, and the resilience of journalists and the importance of us thinking about our mental health and making sure that we are okay so that we can tell your stories. I think very often if you don't work in the media, there tends to be this perception of the media, but at the end of the day, journalists who work in newsrooms. We are your neighbors, we're your friends, we're the people that you run into in the grocery store, and we're trying to do our jobs to get you the information that you need to help you make informed decisions about your life. And so, mental health for me has been important both personally and professionally. And I think we've seen that even more so during the pandemic. So I'm gonna pass the mic over to Christine. And Christine, I was hoping that you could introduce yourself and tell us your story as well.
Thank you. And thank you for your work and sharing a little bit about yourself. And thank you everyone for attending and for having me. My name is Christine Werner. I live with multiple sclerosis, and I was diagnosed in 2012. I was in the IT industry. I retired from Hewlett Packard due to disability in 2015. I have since kind of redefined, my life. My identity was very wrapped up in my career and who I was. I kind of had this path that I thought I was going to follow, and that very much changed. I really enjoy getting to know patients. I've gotten to know patients with all different types of chronic illnesses, and have come to know different types of, mental health issues that come about with dealing with chronic illness and disabilities. Getting involved in advocacy with the National MS Society had really opened my eyes to different legislative health issues that are important to people of all groups and really our entire community, whether or not you're affected with a chronic health issue. It really matters to all of us. So I'm really glad to be here today to, just share and engage in this conversation.
Thank you, Christine. I want to quickly ask you a question based on what you just shared, and I also live with an invisible chronic illness, and so I wanted to hear from you. Why is mental health and well-being such an urgent priority to the chronic illness community and the physical chronic illness community?
So, particularly for MS, depression and anxiety is a function of our disease process. Let alone, when you get the diagnosis, there's some anxiety that just comes along with that about what is my future going to hold? What does this mean for me? What does this mean for my family? Are there questions of, how disabled am I going to be? MS is the leading cause of disability in young adults. Most people find out that they have it in the prime of their lives, in the prime of their careers, usually around the age of, 30. So this, takes into account your ability to be able to plan through retirement. People like me that are taken out of the workforce early, your financial planning shifts quite a bit. We have, like I said, as part of our disease process, depression, anxiety, also cognitive disabilities and challenges, which are one of the main reasons why we're taken out of the workforce, which are very much invisible, as well as depression and anxiety. So, and fatigue is the other main reason why people retire from the workforce early. in addition, we have, unfortunately, something not talked about a lot is a very high divorce rate with somebody that has MS, particularly women. 75% of MS patients are women. That's not to say that, if a man has MS, they won't experience divorce as well. But if anyone has ever been through a divorce or knows someone that has, that's traumatic in itself and usually requires some mental health services. So right now I've just named significant life changes and job loss, divorce, financial changes, getting diagnosed with a chronic illness. And the way MS is, it is chronic, it is progressive, and you're constantly, it's constantly taking. So I describe it as, you're constantly going through a grieving process with little bits of disability you're acquiring along the way. And so having mental health support, you deal with big T trauma and little t trauma throughout the course of the rest of your life. And so I think everyone needs support, not just the person like me that has it, but friends, family, support partners, care partners to understand, learn how to communicate and have skills, to understand and deal, communicate, build resilience, have somebody just to talk to deal with it. I know personally I did for about 6 years to really fully comprehend all of the changes that I was going through, including a divorce myself, the financial changes I went through, the diagnosis, different acquired disabilities I was having, and just trying to understand, who I was and who I was going to be. And I think everybody knows that that doesn't stop. That's kind of a lifelong process. So that just names a few of the challenges, as well as, your activities of daily living. We deal with bowel, bladder issues, living in pain. Living in pain itself all the time is very taxing. Mental health providers can help with strategies on how to deal with that, meditation practices, mindfulness, things of that nature. So it's all very important to have a mental health provider on our healthcare team, to help us navigate the complexities of living with a chronic progressive illness.
Thank you, Christine, and thank you for taking us a little bit into your life and helping us understand not just what it's like living with MS, but the mental health impact on you and your community. I'm going to turn the mic over to Miriam and Charlie. I'm hoping that you can tag team a little bit here. And so maybe we can start with you, Miriam, and you can tell us a little bit about yourself. And then from you, Charlie, you can tell us a little bit about you and your story. And then perhaps we can both hear from you what your thoughts are around mental health from young people, but especially around over the last year and sort of what it has been like for you.
Absolutely. Thank you so much for having me here. It's really an honor to be here and to be able to speak. I'm Miriam Pearsall. I'm originally from Little Rock, Arkansas. I just graduated last week from Emory with my Master of Public Health degree. I'm passionate. Thank you so much. I'm passionate about mental health, especially after experiencing some difficulties in college related to my mental health. I interned at the Carter Center last year in the mental health program, and I aspire to be a leader in behavioral health and behavioral health policy. So I just wanted to share a story in which I became intimately familiar with the repercussions of lack of mental health access. It was the fall of 2020, and I was facing an intense semester of graduate school, along with the burdens of coping with the pandemic, a volatile election season, and then also being Black during a period of racial reckoning in this country. I began to have non-suicidal thoughts of self-harm, so I decided to schedule an appointment with a telehealth provider that was free to me through Emory. I had my first appointment on a Thursday evening around 8 p.m. And within the first 5 to 10 minutes of the appointment, my therapist decided it was necessary to call 911 because she was concerned that I would hurt myself. I was completely baffled by her decision to do that and still feel it was the wrong call. But I do understand that she acted out of an abundance of caution and concern for my safety. It was dark whenever the police arrived at my door, and it was pouring rain that night. I wanted to go get my umbrella, but when the police officer was at my door, I could already see him kind of gesturing for his gun and touching his gun whenever I made the slightest movements. So me not having really interacted with the police one-on-one, I was pretty terrified. And so I just decided it would be better for me just to get drenched in rain. So after the ambulance arrived, I went to the ER. I was discharged a few hours after I arrived. They determined that I was not suicidal or in imminent danger of hurting myself. And so this experience was intense for me, and really gave me more insight into kind of the failings of the mental health system. And so there are a few takeaways from my experience that I wanted to highlight. So first of all, I was in the ER during the thick of a COVID outbreak in Atlanta. So that was very concerning for my safety. I was also very concerned for my safety. Interacting with the police was definitely very traumatizing, and especially in that mental state I was in. And I ended up with a $200 copay from the ER, which may not be a lot for some of you, but is a lot for a broke graduate student. So I was fortunate that I was able to pay for that. After my experience, I have since not felt comfortable seeing a telehealth provider. So I tried to start in-person sessions, but I stopped after about my third session with the provider due to the cost. It was just too much for me out of pocket. So I just want to conclude by saying I consider myself very fortunate that I had the presence of mind interacting with the police, that I even had insurance coverage, and that I have support from a good roommate, family, and friends. And I know that many people don't have the privileges that I do. And so that really is what drives my passion for increasing mental health access for all.
Thank you for sharing that, Miriam. That sounds like a completely terrifying experience, especially also in the middle of a racial reckoning. So I know that that must have been difficult. You mentioned something about some of the barriers to mental health care, and not just about having 911 called on you, but the cost of it as a graduate student. And I know that you see yourself as having some privileges, but you did bring up an important thing about challenges to healthcare access, to mental health care access. So I'm going to put a pin in that because we're going to come back to it to talk more about it. But let's hear from Charlie. And Charlie, what is your story? Tell us a little bit about you and what brought you here today.
Good afternoon. My name is Charlie Wood, pronouns he, him. I'm a rising senior at Georgia Tech and a mental health advocate for my campus. I was diagnosed with depression and anxiety my junior year of high school. I was a closeted gay man, and that put a lot of pressure on me, where academics and athletics were kind of like an armor, where if I tried hard enough in those sectors of my life, then it wouldn't matter if I was gay. And that was not a sustainable way to live my life. And it eventually got to a breaking point. I've been off medication for 1.5 years now, and I had been doing really well. But then I realized I needed an oil change for my mental health care. And I did go back to therapy this past year for telebehavioral health. That's actually something that I've been really advocating for at Georgia Tech, where originally when we first went virtual, we were looking for as many telebehavioral health options as possible because many of our students are international students or out of state, around 50% actually. And because of licensing laws, you can't access our free counseling center when you are not a resident of Georgia, not physically located in the state. And so we were looking to develop other partnerships. We didn't wind up actually pursuing a contract because the cost was a bit prohibitive. But we were able to transition to a fully telebehavioral setting for our care center, which is a triage center for mental health care, and also for our counseling center, which provides counseling. Telebehavioral health is really important for increasing access, we found, especially for college students. It's not perfect. For example, Miriam's story draws a really great distinction between what one's experience might be and what another person's might be. And it's definitely a range, but it does increase access because there's flexibility, especially for a college student where you might not have a car and be able to get to an in-person appointment. And we really hope that we can keep empowering students to be aware of what options that they have, because most colleges have a short-term counseling model where we are trying to get the people who are in crisis into our counseling system as fast as possible. And so that means that we will transition the people who have been stabilized to longer term solutions. So that way they can have a more sustainable counseling option. But that means that once you are no longer able to see that free counseling option, and in some cases, it's not even free for all college campuses. But once you're transitioned to a longer term point, you need to have insurance, and you need to have good insurance to access the care that you deserve. And that's hard for people. So addressing parity and understanding how that impacts college students who don't have as much money, who are a little more transient, who might not live in state or out of state. It's been a year really coming to terms with everything, especially as an LGBTQ plus student. A lot of students don't have safe homes where they feel comfortable, one, accessing care, but also their very environment is not affirming to their own identity. We're still advocating for mental health education, so people are getting help sooner than they ever would before. We actually just partnered at Georgia Tech with EverFi for a mental health care module, which will allow students to be more aware of when they should be getting help. But it's a lot of challenges, but also a lot of silver linings, for example, with telebehavioral health, and hopefully we can return to better, not normal.
Well, Charlie, I mean, thank you for all the important work that you're doing right now. I mean, just as a student and the impact that you're making in your school community, I'm sure that there are so many students that are benefiting from the work that you're doing and that are probably not having to face a lot of the complicated challenges that you have because of what you're doing. So before we get to Jen, let me ask you, Charlie and Miriam, about tell us a little bit about why you see mental health and well-being as such an urgent priority in your communities.
Okay, I'll go first. I think for me, I'll speak for Black people and people of color in general. I think, as I mentioned earlier, there's just this racial reckoning going on in the US. And as you mentioned earlier, Carrie, there's a lot of vicarious trauma that Black people experience due to this heightened attention kind of on racial injustice, and also just from maybe well-meaning friends and family who want to talk about race and racism, and that can be kind of taxing on us as people of color. And so I think that for that reason, mental health and well-being is really urgent. Unfortunately, there are these huge barriers to care for people of color. And also for those who are, well, young people, I'll just speak for young professionals who are maybe just getting into the workforce and haven't made that much money yet. It's really difficult this period right now due to kind of high rates of unemployment, trying to find work. Many of us live with our parents. And I think for those reasons, it's really urgent that our mental health and well-being is prioritized, and that there are affordable options that we can use to find treatment.
Thank you for that. I remember thinking that, after some very traumatic events in this nation around racial violence, I remember thinking, you know, I wish I could get a day off from like microaggressions. I wish I could get a day off from dealing with, racism just in everyday life. And that thing that doesn't go away, even if you're in a virtual setting, they still happen, right? And you don't. And so you'll be dealing with everything that's happening in your macro environment and then everything that's still hitting you every day. And so, yes, I get it. It's like um, the pressures and the issues that we're dealing with on a daily basis don't go away. They just get added to by the additional trauma. So Charlie, so let's hear from you about mental health and well-being as an urgent priority to your community.
Miriam touched on this a little bit, but the academic pressures have really been a lot. And it's just, the world has been kind of scary. There's one term, so Gen Z was turned into the Zoomers to make a pun at the boomers. But then there was an article that furthered that and said we're the doomers, where we have a very pessimistic outlook on everything in the world going on, because there's a lot of news right now that is very traumatic for a lot of people, and seeing that constantly, whether it be racial injustice, whether it be climate change, whether it be the job market. So many people are opting for master's programs this year after graduating because the job market is just so rough. We have a lot of pressures facing us, and even just from social media. And those academic pressures have grown while resiliency in our generation has tapered off in some ways. And not to say that we aren't resilient, but some of our basic tools, we are having trouble using them for our current environment. And teaching people how to do self-care and how to be as proactive as possible with what they're feeling is really important. And some of the crisis and epidemic for mental health in our generation that we're seeing is a result of really positive work, where we are coming closer than ever before to reducing stigma and to having more normalization around different conversations. And so some of it is also, we're seeing more people trying to get help than ever before. But with our mental health care system not where it necessarily needed to be, that's flooding that system. And it means that it inhibits the access for other people when they do need it, because the demand is just so high. So we need to lower the curve for our mental health care system, kind of like how we lower the curve for COVID. Another issue, especially from the LGBTQ plus community, is that being at home during COVID has been very hard. And LGBTQ plus youth, 2 out of 3 are in an environment that does not affirm their LGBTQ plus identity. And when you are in an environment that doesn't support you and accept you for who you are, that puts you at a higher risk for attempting suicide. So it's a lot of different factors, and we can definitely overcome, but being mindful of how we increase the access and really empower students to have self-efficacy in getting their own mental health care as well is really important.
Thank you, Charlie. As a recently identified, apparently, in a recent article, I am a geriatric millennial. So we are looking to whatever they have decided to call your generation today. We have been looking to you because there's so much leadership from you right now, and you all are setting an example with a comfort level around honesty and candidness with mental health and addressing mental health that is admirable. So thank you. So I'd like to hear from Jen. Jen, you work with the Giving Kitchen, and you've probably seen really intimately, especially over the last year, the impact of the pandemic on food service workers and just how that has affected access to behavioral health care. So can you tell us a little bit about you and what's your story, what brought you to us today?
Absolutely. Thank you so much. I have to first commend and say thank you to each of these panelists today. I have already had tears in my eyes. I just so appreciate your courage and your advocacy work. It's really inspiring. And that's a lot of why I'm here today and do the work that I do. Hello, I am Jen Heidinger Kendrick. I am the co-founder of Giving Kitchen, and I'm also a full-time teammate working in our marketing communications department. I'm also our spokesperson, and so I get these really amazing opportunities to talk with our community about what it means to be in the food service industry and the types of hardships that our food service workers face. I will say this, food service has the second highest rates of suicidal ideation. There are 38% of food and beverage workers report always or often feeling isolation at work. And over 10% of all food service workers have been diagnosed with depression compared to the national average of just over 7%. These are just minor statistics of things that we're seeing broad scale. And during COVID-19, that has gone up for food service, upwards of 25% in regards to feeling isolated and having suicidal ideational thoughts. What Giving Kitchen is a nonprofit to help food service workers. We are here to support food service workers in crisis through emergency financial assistance and through a network of community resources called our Stability Network program. So our Stability Network program connects food service workers throughout the state, actually nationally, to local, regional, and national resources in their times of crisis. And we can also offer financial assistance to food service workers in Georgia and in Tennessee when food service workers are impacted by an illness, injury, death of a family member, or a housing disaster like a flood or a fire. What makes the month of May, and obviously, as we all know, the nationally recognized Mental Health Awareness Month, so amazingly important is for a lot of these statistical reasons. Like Charlie had said, the isolation product that we face while being at home has really has taken a toll on our food service industry. This is an industry that cannot be automated. This is an industry that shows up to work and is told to put their feelings aside just to help with the productivity of a restaurant or the food service community. And so it is a real issue. What brought me here, the reason why Giving Kitchen exists is it's a story that was born out of my late husband actually was diagnosed with terminal cancer back in late of 2012. He was a chef here in Atlanta. We're both from Indianapolis, Indiana, but moved to Atlanta in 2004, and fast forward to 2012, diagnosed with stage 4 gallbladder cancer and given 6 months to live. And it was our community, it was the Atlanta restaurant community that really stepped up to encourage us and support us in our time of need. There was a fundraiser put on to help get us through Ryan's last year that ended up raising a significant amount of funding, more than we ever needed. And that's really what inspired the formation of Giving Kitchen, to be able to give back to our community. From early 2013 to today, what Giving Kitchen does are those two core opportunities, two core programming through financial assistance in our Stability Network, again, to food service workers in Georgia, Tennessee, and then nationwide through our Stability Network. I identify as a widow, as a wife now, as a mother now. I use pronouns she, her, hers. And it's far too often that we hear stories of food service coming to the table to show up for each and every one of us. And in their times of crisis, what, the emotional toll that takes on them. What Giving Kitchen is doing to support mental health awareness this month specifically is that we've put together a program called Giving Kitchen Mind Matters. And we too, as an organization, are offering a series of monthly seminars and panels and talking about these discussions at hand: substance abuse, addiction, sexual harassment, what is mental health from top to bottom, and really just showing our community that they are supported and that it is okay to ask for help. So that's a lot of why I'm here today, to share my personal story and a little bit more about Giving Kitchen.
Thank you, Jen. Firstly, let me extend our condolences to you on the loss of your spouse. And thank you for sharing. Thank you for the work that you do especially for food service workers. I know very much they're over the last year, especially they've been seen as frontline, right? Frontline in very much the same way that we see emergency responders being frontline, and that there is a mental health impact, not just of that, but like even pre-pandemic of services that are available to you, of even if it's customer facing issues, these are all impacting the health of the food service worker. So thank you for the work that you do, and thank you for sharing that. I want to throw a question out to everyone, and like, please just feel to unmute yourself and chime in and then pass the mic. We touched on this a little bit earlier with Miriam and with Christine. Can you tell us about what are some of the challenges, not just that you have faced or that you've seen others face, but that you think we all need to work on to address for equitable access to behavioral health care? Because if you were here earlier, we did a poll, and everyone voted on where are the gaps. And one of the biggest gaps that we saw was inequitable access to behavioral health care. So can you talk a little bit specific to your experience or your community? What are some of the challenges that we all need to work on toward more equitable access?
I don't mind speaking to that. So with the National MS Society, with the Government Relations Advisory Committee that I sit on, our state action day was held in February, and we already started the conversation with our Georgia legislators about mental health parity. And, of course, we're all hoping, to pass some sort of legislation in the state of Georgia, but particularly around access and some of the challenges personally I faced, and I know other people have faced. More and more providers in this area do not accept insurance. They don't want to deal with it. The pay rates are low, and so most of the time, and the people that I've seen, you're paying rates of 100, 120, 30, 150 an hour, depending on the type of licenses that they have. And they'll give you a receipt and they say, you can try to submit, an out-of-network claim to try to get a portion of that back. If you do have the kind of money to do that. And we all know that a once a month appointment isn't gonna cut it most of the time, weekly or at least every other week, so you're looking at, rent or the car payment, worth of money to front. And the insurance companies aren't real quick about getting back to your submitted claims to get your money back. So sometimes it could be 6 months worth, that, a few $1,000s worth that you're waiting to see, am I going to get a portion of this back? And most of the community that has chronic illnesses are on disability, whether it be SSDI or SSI, and they don't have that. They don't have that kind of money. Another issue I've seen, if you do have coverage, you have very limited visits for care, number of visits for care per year. So that's really hard to get some type of established treatment plan and follow through. Like we were talking about, therapy is, a lifelong journey, if not, can't be limited to 6 visits a year, or something like PT, for your shoulder or whatever. And I say that because I'm actually in the midst of doing that right now. So it's, it's hard. And then I also have encountered people in the community that just are denied mental health services because they're not medically necessary. And then not given any reason beyond that, which is frustrating. And sometimes people are forced to go out of network, and then, you're paying anyway. Another issue I've had is at Shepherd Center, where I go, for example, and I was seeing a neuropsychologist there for therapy. A few years ago, at the time, my primary insurance decided to pay them at the rate for behavioral health, which was not the same as what it should have been billed at. And so then they try to play games at the rate and the coverage. And so, yeah, there's a slew of issues with, access being one, just one of many. So I don't know if that answers your question.
I'll chime in as well. I think from a really
I'm going to pause. Let's just pause for a second. We have about 4 minutes left. So I'm going to ask each person to weigh in, take 1 minute to weigh in individually and tell us about the challenges that you would like us all to address for equitable access. We have a lot of folks on this call that I think are involved in mental health advocacy and in the fight for parity. And so what are the challenges you would like us to work on to address equitable access? Let's take 1 minute each and just quickly share.
I'll start just because I think that was a perfect segue of what I was going to say. It maybe from maybe an obvious standpoint, but maybe not to many of us. Profit margins in general for the restaurants and restaurant owners are incredibly small. And there is a massive gap within that. It's commonplace that you have a couple of restaurants, you're doing really well, you've got a big staff, and the reality is that you barely are making anything. An average line cook lives below poverty. I mean, an average line cook from our data makes $27,000 a year. There is an incredible gap in the access of what is available to what our food service workers are getting from a Giving Kitchen perspective. I would say, I do want to mention through our stability network, if there are any food service workers out there watching, or if you guys know of any food service workers, Giving Kitchen does offer free or low cost connections to mental health counselors. Even if you have suicidal ideations, if you're a food service worker out there and you need access to something, please come to Giving Kitchen and ask for help, and we can make sure that you've got the care that you might need.
Thank you, Jen.
Okay, I'll go ahead and go. I just want to start by saying I'm a huge proponent of expanding telehealth access. And, my story is just my personal story. And I think hopefully it does add some kind of nuance when we think of interventions, that there's always going to be downfalls to any kind of intervention. But I am a huge proponent of that. So I just wanted to make that clear. I think from my experience as well, having a mental health provider instead of having the police at my door would have been really helpful. And maybe even if I'd had that, I maybe could have prevented myself from ending up in the ER. And so I think those crisis intervention teams that are kind of mentioned, and having a stronger kind of emergency response that's more accommodating to those with mental illness would be one of the things that I really care about in general. And then also just reducing discriminatory systems that criminalize mental illness, increasing integration between behavioral health and primary care, focusing on a culturally competent workforce and increasing the pipeline for that. Those are all things that I would like us to focus on and work on. Thank you.
Thank you, Miriam. I hope folks were taking notes too, because you all are offering some insights, some really good insights. And Charlie, let's hear from you before we wrap.
I'll be brief, but I think one of the best ways that we can really fight for our students is also, we have a backlog in our mental health system where the average time to see a psychiatric professional is 25 days. And in the time of the student, that's really long. And crisis services are kind of the go-to now, where we procrastinate getting help until it's at a breaking point. And so having more access upstream and having a reduced waiting time where you actually can see someone within 2 to 3 days is really important for increasing access.
Thank you, Charlie. I would like to thank all of our panelists from the bottom of my heart for sharing your stories today, for being honest, for giving folks such great insight into your experiences. I think that it is hard to hate when you know somebody's story. And I don't think anyone arrived here hating today, but I think when they understand your story, it helps personalize an issue in a very human way. So thank you for sharing your stories. I'm going to turn things over to Helen Robinson. Helen is our Associate Director of Public Policy, and I believe she's going to talk to you a little bit about parity.
Thank you so much, Carrie. And that was such a rich conversation. I was definitely taking notes, so I appreciate everything that you all brought to this conversation. We titled this discussion Mental Health for All because 5 out of 5 people, or you can say 1 out of 1, like we heard earlier, have mental health, just like with physical health. We all lie somewhere on a continuum. And due to the events of the last year, currently many are seeking behavioral health care for the very first time, while others are seeing their pre-existing conditions exacerbated. And I loved what Christine said earlier about the big T and the little t of trauma, because I've been struggling to think of how to describe this, but I know folks with the big T this past year, and all of us have had the little t. And CDC tells us that younger adults, people of color, essential workers, which as Jen described, certainly include food service. I would add, I've been thinking a lot about local election officials and workers as being essential workers lately. And unpaid caregivers are disproportionately affected by the trauma and the challenges that we've had in this recent year. And let's not forget women. Women experiencing job loss at high rates, lack of childcare, and unfortunately increased domestic violence. And unfortunately, prior to the last year, we already had barriers to access to behavioral health care in Georgia. And now that demand is increasing, we know that unmet need is going to increase. One immediate solution for our state would be to enforce parity. Next slide. Parity means that mental health and substance use conditions receive the same level of health insurance benefits as physical health conditions, whether a person has public or private insurance. Parity is one of the 7 critical elements of the unified vision that we talked about earlier today, and it is highly related to other critical elements, including equity and the integration of behavioral health with physical health care. And what I have found is that parity underlies so many of our access issues in the state of Georgia. Next slide. For example, in our rural communities in our state, of course, we have a high proportion of people without insurance at all. But for those who do have insurance, they face behavioral health workforce shortages. And parity would help by ensuring that providers are able to seek adequate reimbursement for their services. And if providers knew that that was insured, they would be more likely to locate in these areas. And of course, telehealth, as was mentioned earlier, is so important as well. Next, I believe, and hearing this conversation we just had makes me believe it even more, that we can meet this moment if we join together to improve access to care in Georgia. And these are just a sample of the organizations that are collaborating to advocate for parity enforcement. I could not fit them all on the screen. We know that our state can become a leader in making behavioral health care more equitable and easier to access. Next slide. So what can you do? First, I want you to know your state legislators. I want you to know your state senator, and I want you to know your state representative. You can plug your home address into openstates.org, and you can see who they are. I charge you to make them your friend. During this break between legislative sessions, we have between now and January of next year for you to do this. I know that everyone talks about federal policy, but the state is where the rubber hits the road. And your state elected officials are accessible to you. You don't have to meet with their staff, you meet directly with them. And they will listen to you, they will care about your priorities if you live in their district. And that is a fact. If you ever find that not to be true, please call me and tell me, I want to know. Also, be sure to contact the governor's office as well. And tell them your story, just like you heard how incredibly powerful it is to hear a personal story about the need to access behavioral health care. And also tell them it should be as easy to get your behavioral health care covered by insurance as it is to get physical health care covered, especially right now. This should be a top priority, a nonpartisan priority for all of our elected officials and everyone who is seeking office at this time. And Anna has placed into the chat a just one-page front and back policy guide that we developed about parity so that you can simply hand that to them, email it to them. You don't have to be a technical expert on insurance. I'm not, but you can tell your story and you can let our elected officials know that access is more important now than ever. I would also ask you to tell them that investing in behavioral health is urgently needed now. We have an unprecedented amount of federal relief funds coming to our state right now. And in the next 2 to 3 months, decisions are going to be made. It is critical that that funding be considered for behavioral health needs. For example, to enforce parity, or I think about what Miriam and Charlie were just talking about, building out that continuum of services so that when someone is in need, there is someone to talk to, there's someone who can be there for that person along a continuum, because we simply cannot serve the need that we have right now without insurance companies adequately covering treatment, adequately reimbursing those providers, without shoring up our workforce, and without treating mental health as an integral part of the health of our community and our economy. Now is the time for us to finally achieve mental health for all. And I really hope that all of you were inspired by what we heard today to join us in that movement. And with that, Eve, I'm going to turn it back over to you. Thank you so much.
Thank you, Carrie, Charlie, Miriam, Jen. We look very much forward, Christine, very much forward to continue to work with you and your organizations. We appreciate you sharing your stories and being with us. As you all know, we've said it before, today, May 20th, is Mental Health Day of Action, and Mrs. Carter is one of the 800 influencers, political leaders, and celebrities who have committed to encouraging those in their circles to act. I hope that you have gained some ideas and are personally committed to acting on these ideas as we close out today's forum. Please continue to use the chat to provide your thoughts. We will be capturing all of the input in a document following the forum, as I mentioned earlier in the day. Before closing, I want to give you a glimpse of our agenda for tomorrow. We will begin the forum at 11 promptly. Please jump on 20 minutes ahead to make sure you can connect, because if you don't want to miss anything. Topics of conversation and call to action will include Georgia innovations in supportive housing, back to school, importance of implementation of universal prevention and early intervention best practices, and a panel on work that's taking place to assure people with mental illness or dementia obtain the appropriate supports and their human rights are protected in the guardianship process. We look forward to seeing you back. Make sure you have registered so that you receive a link for tomorrow, because your today's link won't work tomorrow. So please make sure you're registered for tomorrow. And again, from the bottom of our heart, we thank you for choosing to be with us this afternoon. We hope you found it a good use of your time. We certainly enjoyed being with all of you. And thank you again to all of our panelists. We hope you have a great evening, and we look forward to seeing you early tomorrow at 11 a.m. Thank you.